Okay, so this is the second part of Chapter 22, and this is a special talk about migrant farm workers and HRSA, which is the Health Resources and Services Administration, who would assess and provide services for vulnerable populations, defines migrant farm workers as individuals whose principal employment is in agriculture on a seasonal basis. People who establish a temporary home for the purposes of such employment. So migrant means they are migrating. They are moving around. They are following the harvest or the plantings. They are paid by piecework. They're paid by an hour or on a daily basis. And as some of you saw in the movie on the Tuesday, clinical groups that went, it's backbreaking work. And so we're going to talk about their special needs, because this is another vulnerable population who is at risk for poor health outcomes. So these are the big migrant states, Illinois, Michigan, New York, of course, California, Texas, and Florida. And so we do have pockets of migrants, so we should be aware of them. New Jersey hosts migrant workers. Delaware, Delmarva, the Delaware, Maryland, Virginia area down here, where the farms are, and then Pennsylvania also has migrant farm workers and other migrant workers. So they're employed in the agricultural work, but these are not considered part of migrant health. And so migrant health has a special category under the federal government that will provide money to provide migrant health services, but these groups are not. So landscapers are not part of the migrant health program. Meat and meat product wholesalers, the ones who work in the meat factories, in the chopping and cutting and packaging the meats, are not part of the migrant health program. Transportation of livestock, the truckers who drive the pigs to slaughter, to the slaughterhouses. Trucking of timber is also not migrant, even though these truckers are on the move. And then spectator sporting. And so I can tell you that Montgomery County, Bucks County, has a lot of landscapers that are people who are migrants, who are immigrants from other countries that are doing this hard work. Also meat products. There is the Dietz and Watson, maybe, factory up in Lansdale, where migrant workers work. I know there was a terrible accident on 309 where the meat workers were coming home after a night shift, and they crashed, and they were, I think, from Kenya or from Haiti. There was a group of 11 of them in a van going home from Lansdale back to Philadelphia. And so they are immigrants, but they're not under the migrant health program. Spectator sporting, those of you who are at the racetrack up at the Parks Casino in Bensalem, these are the jockeys and the men who train the horses. They are not considered under this special status of migrant health. So I will put this link for the migrant child farm workers up, so that if you did not see the talk on Tuesday, then you can get a taste of what life is like, what kind of mental anguish the families are under, the hard work that they do, and how the children suffer from having to go into the fields to help make money for the family. They're vulnerable because of their rural location, which again adds to isolation, and then their migratory patterns. So their housing is very poor housing, because farmers figure, they're moving on. They're going to go to another place. They're not going to live here long, because they're going to follow. So here's just an idea to give you that they may go up to the Pennsylvania area and then back down, depending on the harvests. They come in and then they go up to do the work, and then may stay there. We see that in the mushroom farming in Kennett Square. And then there's smaller patterns of migration over here on the left, where they kind of stay between within a state doing the work. But there could be other large patterns of migration where it's harder for them to be connected to a school, harder for them to be connected to health care. So the health issues for farm workers, there's heat-related illnesses. You can imagine being out in the fields in the middle of the summer, weeding the fields, planting the fields in mud, and being out in the sun all day. The exposure to the sun, pesticides, the toxic chemicals that are used, the fungicides that kill the weeds, the pests. If they're not mixed correctly, they can be toxic on the skin. A lot of injuries can involve those chemicals. Equipment and hand tools. If you saw the little movie of the children, they're cutting strawberries, they're cutting broccoli, they're using knives, machetes, they're cutting through, and they can be injured. Urinary tract infections. When you look at that movie, there is no bathrooms, there's no porta potties, there's nothing. So they may have to hold it all day. They may not be drinking enough water. They may be, not wiping with paper and using proper sanitation, so they are at risk for UTIs. They're at risk for snakes and bites from insects and other mice and geese that live out in the fields and are living off of the off of the vegetables and the fruits that are growing there. They can fall from ladders, they can get conjunctivitis from being in the sun, from the eyes being dry from dust, and from the other chemicals that they're exposed to. And then, because of unsanitary, crowded housing, less than comfortable, less than meeting basic needs housing, they can be susceptible to infectious diseases such as tuberculosis and impetigo, and things that can spread oral fecal route. They have mental health issues because they're stressed by having to work and worry about getting paid. They can be cheated. They are sometimes cheated. They have anxiety from not knowing where their next job is coming from. Perhaps their car is on its last leg. They need new tires. They can suffer from substance abuse, from the depression and the anxiety that they're suffering from. Domestic violence can be an issue. They can suffer from discrimination, as we've seen in this current term of administration, backlash against migrants and immigrants. They can suffer from separation from their family, worrying about their family back in their other country. They can be isolated by language, by being out in the farms, by being disenfranchised again. And then they can be fearful of their immigration status. They can be greatly needed by these farmers, and we'll talk about the visa that they need, but if they don't have the correct paperwork, they're doing a job that the farmers need, but they just don't have the paperwork to back them up, and so they're fearful of that. So again, some more issues. Transportation of getting to the clinics. If the clinics are only open during the day and the farmers have and the migrants have to work all day, then they can't go. They have to work to get the money. Tracking them. I got a vaccine in Minnesota, and then I moved to New Jersey, and New Jersey says, well, where's the record? And they say, well, it's in Minnesota, and there's a lack of belief or evidence that they had that taken care of. Language barriers are a problem. Discrimination, again, being looked down upon. Documentation issues of carrying their records with them or having to leave them in a clinic. Their housing, their lifestyle, the children of the migrant workers. Dental disease is an issue. If you are on the run, not on the run, but on the move, do you have running water in your house? Some of the migrant housing does not have running water. They have to go into a building to get it or far away. TB has increased, incidence of HIV and AIDS has increased because of unprotected sex, and also could be IV drug abuse. They lack clean drinking water, and again, the workers' compensation coverage is not covered for them. because they're temporary workers. So this H2A Visa program is a temporary visa program, but it's a little bit cumbersome. The farmer has to petition for workers in another country, bring them over, work with the embassy, work with the consulate, and this is a list of the countries as of January 18th, 2018. I see, you say, well, that's a lot of countries, but you might be able to think of some countries that aren't here. Mexico is on here. Paraguay, where I was, is not on here. Is El Salvador on here? El Salvador is on here. Guatemala is on here. So there are countries that are allowed, but you can see that this, of course, is not all of the countries in the world. So there is a limit of who can get an H2A visa to come to work temporary in the United States. So it's helpful, and it's working better now. Since when I did Migrant Health in Minnesota, the migrants came up from Texas or from Mexico, but a lot of them were from Texas. They went into Minnesota. They planted the sugar beets and weeded them. They went over to New Jersey, did some harvesting of fruits and vegetables, came back to Minnesota at the end of the season. We were gone by then. I was there in May and June for the beginning of their move, but they went back and harvested the sugar beets, and then they went down south when the weather was starting to get cold and nothing was growing anymore. But there's this need to have toll-free access so that clinics can be called to verify vaccines, verify treatments. Culturally competent staff. We see culture again here becomes very important. Bilingual staff for the different cultures that come. Patient care coordination services. Home visits. Nurses, I worked with the program. We went and did home visits in the evening to visit the migrants because we know they couldn't get out during the day. We had a clinic one evening a week at a doctor's office that allowed the Migrant Health clinic to work on that. Technology can really help. Telehealth can help. Text messages, telephone calls for follow-up, collaboration with agencies, helping transport, maybe taking a mobile medical unit out to do screenings, which would take people a few minutes or allow them to get screened on their lunch hour. Case management becomes very important, especially if direct observational therapy needs to be implemented for tuberculosis cases or other issues. Vaccines can be taken out to the fields. And again, culturally sensitive health care information needs to be provided. This is just a list of resources that are available, and you would just have to copy off the list because you can't click on it to get to it. But there are people who are concerned. The story of Cesar Chavez and the grave workers in California fighting for their rights, and other groups become very important for us to reach out, because if these migrant workers are not there picking our fruit, the prices of everything will go up. And a lot of them cannot be harvested by machines. Otherwise, a farmer would say, well, I'll get the machine, but you just can't get a machine on an apple tree. You can't get a machine on an orange tree. So migrant workers are very important to our health, for our vegetables and fruits, and for nurses need to provide for their health. And they are a special group because of those mental health issues and their exposure issues, and the need for primary, secondary, and tertiary care. Thank you.